Welcome people. In this video, let us look at antidepressant drugs. I am showing you here the actual course that we are coming. Pharmacology, central nervous system, under central nervous system, mental illness, and antidepressant drugs. Under antidepressant drugs, you have classification, tricyclic antidepressants, tricyclic antidepressants, example imipramine has been asked in your examination. Selective serotonin reuptake inhibitors have been asked. Fluoxetine, fluoxetine has been asked. What are the advantages over imipramine has been asked over 10 times. This has been asked in your examination. That is selective serotonin reuptake inhibitors, that is SSRIs, have been asked many times. Please note, that's the most important question for you here. Then you're coming to MAO inhibitors, monoamine oxidase inhibitors. This is a very important question again. And so these 4 slides let us look at, okay, in this video. So the topic here is antidepressants. Let us look at the classification in this video. Antidepressants, right? We can also first look at the definition of antidepressants or of depression actually. Definition of depression. Okay. We look at definition of depression and the classification of antidepressants. Okay, first of all, definition of depressants. Okay, definition of depression. Depression is a clinical condition, okay, and it is associated with a feeling of sadness, loss of interest, self-neglect, anorexia, sleep disturbances, suicidal feelings, etc. So they are just telling you a lot of things, like it's a clinical condition where there is a feeling of sadness. It's a condition. They are not saying it's a disease. It's a condition where there is feeling of sadness, lack of interest. Yes, lack of interest. Okay, then self-neglect, anorexia, sleep disturbance, suicidal feelings. Okay, you can say the person always feels like crying or there is tears rolling down. Apparently there is no important cause or a reason for that, okay, or whatever is very trivial cause, you find it very trivial, nothing that has to push the person into so much of depression, right? So we are done with the definition of depression here. Let us look at why it can happen. So let us look at the pathogenesis of depression, correct? We're going to look at the pathogenesis of depression. Now, decrease in levels or function of monoamines in cortical and limbic system. So what is happening here? The location, let me tell you first. In the cortical and limbic system, there's a decrease in the function of monoamines, okay. There's a decrease in the function of monoamines, or there could be a decrease in the levels of monoamines. So let me put an arrow here to depict. A down arrow please. Yes, a down arrow. So monoamines are less in the cortical and limbic system. Decrease in brain. Okay, what are these monoamines? We didn't tell you that. Monoamines are 5-HT, that is serotonin. NE is what? Norepinephrine. DA is dopamine. So in decrease in these monoamines in the cortical and limbic system can cause depression. One more thing you have to know here. Decrease in the brain-derived neurotrophic factor, BDNF is less. BDNF is what? brain-derived neurotrophic factor is less. Okay, what is happening to brain-derived neurotrophic factor? Again, it is less. Brain-derived neurotrophic factor is less, and there's abnormalities in Hpa axis. Let us look at this. There's one more cause here. Abnormal Hpa axis, thyroid function, sex steroid levels. So all these also can cause depression. I'm just trying to look at what Hpa axis is. It is the hypothalamic pituitary adrenal axis. It is a central stress response system here. It says central stress response system. This is the hypothalamic pituitary adrenal axis. There's a diagram here. The hypothalamus here in yellow, pituitary. Right below that will be the pituitary and adrenal cortex. Okay. So this axis is disturbed. Okay. So what is Hpa axis? Hypothalamus, pituitary, adrenal axis. There is abnormal. So there is not a proper regulation of the hormones. So the sex steroid levels come down. What are the sex steroid levels? They can cause what? Addison's disease. Say Hpa.
Hpa axis.
Very good. Oh my God. Okay, so you have the Addison's disease, early morning depression. All these are because of less corticosteroids. Okay. Fine. So abnormal Hpa axis. What is Hpa? Hypothalamus, pituitary adrenal axis, right? So even decreased thyroid levels can cause depression. So hypothalamus, pituitary adrenal axis will be abnormal. Addison's disease, early morning depression, sex steroid levels will be less. Got it? So these are the pathogenesis of depression. Let me revise everything that is done in this video. Okay, so in this video we saw definition of depression. Depression definition is, it's a condition, clinical condition, where there's a feeling of sadness, lack of interest, self-neglect, anorexia, sleep disturbances and suicidal feelings even. Okay. So anorexia is something to do with food, you know, they don't want to eat food. There is lack of appetite, right? They fear that they'll gain weight. Okay. No appetite, or they suppress their appetite, right? Sleep disturbance, suicidal feeling, we covered that. Very good. Let's move on. The definition of depression is done. Next, pathogenesis of depression. It can be because of the decrease in the monoamines, that is the serotonin, norepinephrine, dopamine, where in the cortical and limbic system these three can decrease. The monoamines, these are the actually the neurotransmitters. These actually make you feel happy. What and all make you feel happy in life? Serotonin. I give you serotonin, you should be happy. A bottle of serotonin if I give, you should be happy. If I give you a bottle of epinephrine, you should be happy. If I give you a bottle of dopamine, it means to say please be happy, right? Say serotonin.
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 Norepinephrine.
Norepinephrine.
Dopamine. Not interested. Okay. Now the other thing is brain-derived neurotrophic factor. Brain-derived neurotrophic factor also can be less. BDNF. Say BDNF. Can you say BDNF? Okay. Anyways. Then we have abnormal Hpa levels, decreased thyroid, decreased sex steroid. All these can lead to depression. Okay. Now, in the next video, we have to check how to treat all these. Now that you know the pathogenesis, you should easily be able to treat, right? Very good. In the next video, we catch up. Bye-bye.